My name is Patricia Waller. I'm a family nurse practitioner student at Arkansas State University College of Nursing and Health Professions. This is a comparative analysis of initial and follow-up A1c levels in type 2 diabetes patients. Diabetes is one of the most common and most expensive chronic health disorders diagnosed in the United States over the past few decades. Symptoms of type 2 diabetes often develop over several years. Many patients can have symptoms for a long time without recognizing the danger signs, and some may never notice any symptoms at all. The prevalence of type 2 diabetes increases with age and comes with a multitude of complications, including kidney failure, neuropathy, amputations, blindness, and cardiovascular disease. In order to provide adequate care for these patients, providers must detect the disease early and provide appropriate education, as well as ensure safe, effective monitoring of patients receiving treatment for type 2 diabetes. The primary purpose of this quality improvement project was to determine the rate of change in glycated hemoglobin A1c scores for patients diagnosed with type 2 diabetes. Data for this descriptive study was collected during a retrospective chart review from a rural family health clinic in central Arkansas. The random sample included a total of 50 patients. This study included both male and female patients aged 40 to 70 years old with confirmed diagnosis of type 2 diabetes based on ICD-10 coding. Data collected included patient age, sex, initial, as well as follow-up body mass index and A1c values. All appointments occurred between August 1st, 2019 and November 27th, 2019. With regards to ethical issues, a retrospective descriptive design was used, and there was no interventions which could result in possible harm to any participants. Any identifying information, such as names, date of birth, this remained anonymous and was not included in the collected data. There were no other factors taken into consideration when determining the subjects, including race, ethnicity, socioeconomic status, level of education, or any other identifying demographics. The results of this quality improvement project at the data collection site revealed 72%, which equated to 36 out of 50 charts reviewed, showed improvement in their A1c scores at their follow-up appointment. 68%, or 34 subjects, had a decrease in their BMI at their follow-up appointment. Of the 50 charts reviewed, 30 were female and 20 were male, and the average age of the subjects was 54.26 years old. The average initial BMI was 36.03, and the average follow-up was 35.23, or a 0.08% improvement. The average initial A1c was 7.98, and the average follow-up was 7.51, or a 0.47% improvement. As mentioned previously, type 2 diabetes is a significant public health concern, and this disease impacts not only patients but their caregivers and family members as well. Type 2 diabetes is a metabolic disorder characterized by insulin resistance and relative insulin deficiency, which results in hyperglycemia. To simplify this explanation, diabetes is a chronic, lifelong disease where the body has difficulty processing glucose. Instead of being used by the body, glucose builds up in the bloodstream. Over time, high blood glucose levels can severely damage almost every part of the human body, and progression from normal glucose levels to diabetes can take a decade or longer. This study will be useful by bringing awareness to gaps in screening and education for these patients. There are many modifiable risk factors, which include obesity, decreased physical activity, nutrition status, and smoking and/or alcohol intake. Diet is an important tool for managing this disease, and weight loss can help decrease the severity and even prevent the development of associated health complications related to type 2 diabetes. I would like to acknowledge and personally thank Dr. Mark Foster for his contribution as my clinical advisor throughout this project.